All right, everybody. Hi, welcome to the State Attorney Addiction Recovery Task Force meeting. And let's get started. We have a bunch of stuff on the agenda, but I anticipate we'll be getting out of here early. And let me just see who's here from the task force. Dr. Andrick, I saw you're here. Thank you. From the Healthcare District. Tom Baird. Tom Baird. Oh my God. Okay. Turner, I saw you here. Turner Benoit.
Hey there, Al.
Hey, how you doing?
Good, good.
Ann Berner from the South Florida Behavioral Health Network. No, wait, no, that's wrong. No, the managing entity. Okay, is Ann, are you with us?
Not yet.
Okay, not yet. Ariana Ciancio, Delray Beach Police Department. Okay. Dr. Anita Kakovas, Executive Director for Community Recovery Hub of Palm Beach County.
Good afternoon, sir.
Thank you and welcome. And is Darcy Davis with us as well, Dr. Andrick? I know you guys.
I don't think so.
Yeah.
I'm covering for the district today.
Yeah,
For Dr. Phillips.
There's a big shindig going on at 3 o'clock at West Palm.
Yes, we're all heading there. Yes.
I know you're going to make a brief announcement, but I'm heading there too when the meeting's over. Uta Gaziak from Florida Behavioral Health Association.
Good afternoon. I'm here.
Hi, Uta.
Hi.
Mike McKeah from Oxford House. I saw you were on, Mike. Okay, Michael. John Hulick, Palm Beach County. I heard some.
Formerly of Palm Beach County.
Yeah, I was just going to say, I heard, okay. John, before I go any further, just let us know what your status is. John?
Sorry, trying to find. Yeah, if I could, Al, I'd just like to, I think one thing that's true of my 7-year tenure is we have stayed true to the vision of establishing a more person recovery focused care that values the voices of affected individuals and families, particularly parents of loss. I'm really grateful to many, but especially those family members who've, over time shared their pain, shed their tears, and really have propelled in my view, important change. Thanks even to the naysayers who have served as motivators to sharpen the work. I really do look forward to returning to my roots as a passionate advocate with much more freedom to exercise my voice to advance the causes we all care so deeply about.
Thank you, John. And John, it's been a pleasure working with you. I'm sure we'll be working together in the future. For those of you who don't know, John just ended his tenure as Palm Beach County Community Services Department lead on the behavioral health aspect of activities the Palm Beach County government has been trying to assist or facilitate. Okay, Tama Kudman. Tama, you with us? Tama? All right, Kelly Lee from DCF. Kelly, you with us? All right, we are going to have somebody, I believe, give us a little update on the core program. That will be Jessica Durant. She had some conflicts from the department, from DCF. She has some conflicts. I'm hoping she'll be able to get on between her meetings. Jeff Lynn, attorney. Jeff, you with us? Okay, I saw Nancy McConnell, CEO of Rebel Recovery. I saw you're here. Hi, Nancy. Neil McGarry, Florida Certification Board, ED. Neil? All right, I'm going to have to send a letter to some of these folks. Dr. Moran, Robert Moran, you with us, Doc? And I did see Dr. Rachel Needle. Dr. Needle, hi. Haven't seen you in a while. Terrell Pyburn, Coconut Creek City Attorney. Terrell, you with us yet? I know Terrell is going to be tuning in. So we'll count her as here. She'll be here. Susan Ramsey, I saw you were on there. Attorney, also attorney legal counsel for FAR. All right, Michael Schlossman, CEO and Chief Legal Officer of Florida Association of Recovery Residences. Michael, I
Here.
saw you were in there. Hi, Michael.
Thanks, Al.
All right, Terry Shapiro, Executive VP, GIA Miami and Vita Recovery. Terry? All right, Nikki Soda, are you with us, Nikki? I know she had some stuff in Washington in DC that she was attending to. Okay, and I did see Dr. John Siemenides. John, Dr. John,
Hi.
how you doing? All right,
Good.
Alton Taylor from Drug Abuse Foundation. Alton,
Here, Al.
hi.
Here.
Jan Toman, I saw you were here as well, Project Opioid, South Florida. Jan?
Hi, Jan Toman, but South Florida Opioid Alliance. Now, you guys keep forgetting to change the name.
Would you change the name? I've got a crack staff here. And
That's okay, Al. Good to see
That's-
everyone.
okay, thank you. I know Dr. Lori Vinacore from Alliance of Delray could not make the meeting. She had a conflict. Greg Weiss, Palm Beach County Commissioner. Greg, are you with us, or is Nils with us? Could you reach out to his office and see if he's okay? Richard Worms from the Office of Attorney General, Investigations Coordinator.
Yeah, thanks, Al. Good afternoon. I'm here. Some bandwidth issues here with our computers, so I apologize for not being on camera.
Oh, no worries, Rich. Thank you. Eric Urlano, Integrity Billing. I'm going to shuffle a little bit because there are some people who are on the task force who have not been with us for a while. So if anybody who's on the call would like to join the task force, please, just send me an email, ajohnson@sa15.org, or to Marianne Senator, msenator@sa15.org. And we'll see, we'll bring a few fresh faces onto the task force. Let's get to the agenda. The updates. Let's start with the first slide. Many of you have seen from the last meeting. We had a phenomenal reduction in in opioid overdose deaths from 2023 to 2024. While we were unchanged between 22 and 23, when the revised numbers came out, we were a few percentage points reduction, but it ended up being essentially zero. 24 to 23 with all the numbers in. Now this could change because the State Medical Examiners Commission, they generally count things a little differently than we do here in Palm Beach County with our medical examiner. So the number may change, but with all the reports in, we had a 44% drop from 2023 to 2024. The state numbers won't come out until December, January, later on, either in this year or the beginning of next year, 26. Now, the next slide is transports, which this is unexpected and it's significant. For the first 4 months of 2025, we've seen a 29% reduction. And as you can see, for every year except for one, and that was COVID year, we've had a reduction in transports, and this is Palm Beach County Fire Rescue. So it's roughly 50% of the opioid suspected overdose transports to hospitals, okay, would be Palm Beach County Fire Rescue. There are some other local fire rescue like Boca, Delray, West Palm, Riviera, but about 50% of the county is Palm Beach County. And it's incredible that we have a net reduction in Palm Beach County of 70% from 2017 when we were in the heyday. I mean, the worst of the worst until now. We've had a 70% reduction in the first 4 months of each of the years. Very significant 29% in this year over last year. The last slide. This was the eye popper I was talking about. January 1st to May 12th, we just got these numbers from the medical examiner, our local Palm Beach County medical examiner. It's a snapshot because there are outstanding suspected overdose cases where the reports, toxicology reports have not come in. So I don't know how many there are pending, but even if half of them were pending, we still are looking at a 35 to 40% decrease again this year based on the snapshot in the first 4 months. I mean, this is phenomenal. I mean, every death is a tragedy, but compared to where we were when we had 657 in 2017, this is incredible. So you're the first to see this. I just got these numbers this morning, yesterday. Xylazine has almost disappeared so far. Again, this is a snapshot, first 4 months, first 4.5. Fluorofentanyl, similar to fentanyl, has also reduced by what looks to be about 60–70%. And carfentanyl was not very much on the radar in 24, but we have had none so far in 2025. If anybody wants to venture as to the precipitous drop, usually I've got Ariana Ciancio from Del Rey, and she's a pretty good barometer on the ground, telling us what's going on in Del Rey. But if anybody wants to venture, maybe Nancy, you've seen things being, you're in the trench for sure, and you've got your hand up, so please.
Well, I understand what you're looking at is from the medical examiner with, especially what you said about the xylazine going down. We have been doing drug testing since November of last year. And what that means is we take the used syringes of our syringe exchange participants with their consent, and we are sending them into the University of North Carolina. And we also have conversations with the participant. We let them tell us what they think's in there, what they thought they were getting. And then we get the results back within 2 weeks. And then we have a printout of every substance that was in that residue. And we are seeing xylazine, more xylazine this year than we saw a couple months last year. And this is under OD2A. So we will be continuing to do this up till, I think, October of this year. So maybe we could put on some kind of presentation about what we're seeing on these current drug screenings and testing that we're doing.
Absolutely. Nancy, when did you start the screening?
We started it in November of last year, and yeah, it's under OD2A Part B.
Okay.
So we've been wanting to, but this is finally the CDC is allowing for this to happen. And so we're also meeting with the CDC on a monthly basis and going over our findings.
That's fantastic. And we should, as a group, see what we can use those stats for. Clearly, I mean, it's the canary in the coal mine, good or bad, what you're seeing, because you're actually seeing real time. I remember when Dr. Courtney Phillips had informed me that they stopped seeing heroin in their drug testing when fentanyl took over for heroin, and heroin became non-existent almost. And this is getting real-time data like this is fantastic. Now, question, and you can pick July or September meeting, and you can do a presentation. You'll have a little more data then.
Yeah, I think we can do July, but we can do September because we would be our deliverable on that is like 175 tests, and we're pretty much at the middle of that.
Okay.
So absolutely, either one. And I would have Austin do it. Austin and the person that we hired to specifically be over the drug testing part, her name is Hallie. She's been doing the analysis of the results that we get back.
The snapshot we got from the medical examiner was, as you can see, 100% of the overdose deaths so far have fentanyl as a cause or presence. Are you still seeing fentanyl in the syringes?
Yeah, we see that, but all the other stuff we see is it's kind of insane, some of the stuff that we're seeing in there. So yeah, I can talk to Austin and see, and then get back to you if he'd rather him and Hallie to put it together, and they can use the reporting that we're doing to Health Council. And because we send them like a snapshot each month on our reporting. But Hallie and Austin can go over all the different contaminants, how much, the percentages and stuff like that. There's Austin. Go ahead, Austin, you talk about this.
Well,
I'll pop in just to answer your question real quick, Al. So I would say that so we started in October officially, and there was less fentanyl and fluorofentanyl and fentanyl analogs. There certainly still was fentanyl present in the opioid supply. But around like June, maybe May of last year, there started to be a pretty significant shortage globally of fentanyl precursors. And I don't want to be pessimistic or anything, but I would venture to guess, and I'm not the only one, that the significant decrease in overdose deaths that we have seen is at least in part attributable to that shortage. I'm sure that all the other, things that, people like the folks on here have been doing have contributed to that decrease as well. But just like realistically, the dope has been pretty bad. And by bad, I mean like the potency's gone down. Um, Recently, that's changing, and we're seeing kind of a spike in overdoses again. And I would anticipate overdose deaths to go up. I know there was just like 3 overdose deaths in West Palm Beach within hours of each other, I think on Monday of this week. So like when the potency of the opioid supply goes down and when it gets kind of less potent, it's actually more dangerous because everybody's tolerances have gone down. It will spike again, the potency, I mean, and fentanyl is becoming, from what we're seeing and just anecdotally, more prevalent again. And I would not be surprised if we see a significant spike in overdoses. So
uh,
I would anticipate that.
that's unfortunate.
Unfortunately, yeah.
And
Okay.
and Al, this is Alton. Um, we agree with a lot of what we've heard. We in our detox receiving center, we've seen a massive reduction in opioids, and uh, 4 months ago, maybe 5, we had a xylazine overdose, but we've seen xylazine, almost disappear. And we do about 150 um, assessments a month in the detox receiving. And so we have seen that shift. We think the reason for the fentanyl change, just before the Biden administration left office, they had negotiated the chemicals needed to make it. They negotiated a deal with China for them to crack down more. Uh, and they did that. And there were several articles talking about the noticeable impact of fentanyl coming over because of they're not being able to get the chemicals to Mexico from China. So that may not be the only reason, obviously, but it certainly had an impact. And and we've seen a real noticeable decline in that. Whether it'll stay that way, I don't know.
Yeah. Thank you, Alton. One question for Dr. Hendrick. Would these stats be useful for you at the clinic in treatment? I mean, if we had a more formal way to obtain, for example, from Rebel Recovery, that's a very, to me, significant way of keeping stats because you're actually.
I think it's useful for all providers on this call, right? I mean, we are still one of very few testing for fentanyl, but we have all those other residues that Nancy is talking about and nobody has tested for. So I think knowledge of those findings are exceptionally important, that we know what we're dealing with, even if it's negative test. And if it walks as, how you say that, is a quacks is a duck, it's a duck, right? So, I mean, very often all of us providers on this call rely on those, general information we receive from higher ups. So, yes.
Well, maybe we can again, separate silos are keeping separate data. So maybe we can make an effort to, like, for example, Drug Abuse Foundation and Rebel Recovery. Maybe we can gather stats and figure out other providers and or groups that are maintaining statistics and maybe give it over to FAU and try to keep like a rolling stat on where we are with the various drugs. But anyway, thank you all very much. Let's move on to the FAR update, and I'll hand the microphone over to Michael Schlossman.
Thanks, Al. Josh Thrasher and I are going to handle this together. He's going to go through the numbers if you have those first.
Okay.
Sure.
Thank you, Al. Hi, everyone. My name is Josh Thrasher. I'm the Deputy Executive Director with FAR. So I'm going to cover some statewide numbers and then get into some Palm Beach County numbers. So across the state, we have 272 providers that are certified for 9,760 beds across the state. So we're creeping up on that 10,000 mark that we've been trying to get to. And it looks like we're going to meet that here soon. So the levels 1, 2s, and 3s, there's 5,701 beds. Level 4 make up 4,059 beds. Broward County has 27% of the beds, while Palm Beach County has 37.1% of the beds. So here in Palm Beach County, we have 108 certified providers, total of 3,627 beds. There's 1,810 men's, 571 women's. Serving both genders, there's 1,220 and 26 LGBTQ beds. So level 1, we have 6 beds. Level 2, we have 1,786 beds. Level 3, we have 8 beds. And level 4, we have 1,827 beds. So in all this is just broken down by county. So I'll turn it over to Michael.
Thanks, Josh. And Al, thank you. We're going to give an update on our effort to increase MAT bed capacity across Florida, but mostly here in Palm Beach County. So if we have those slides.
Well, we're gonna do that later in the meeting, if that's okay with you.
Okay, that's fine.
All right. You want to talk about any of the other counties or any movement? Do you see any trends right now in terms
We
of
do.
recovery residences?
We have a pretty extensive outreach and education program going on right now. We've been crisscrossing the state. And I think, as Josh said, our goal is to hit 10,000 beds by July 1st. Also, we had a great phone call this morning with NAR. We're getting the NAR Summit here in 2026. And there's a lot of activity around the state revolving not only enthusiasm about FAR, but answering some questions that remain about benefits of certification and who needs to be certified and who doesn't. And the staff and I have been diligently working on that, which is one of the reasons for the increase in numbers, despite the fact that we had a bunch of programs close earlier in the year. So we've made substantial progress across the state, not only in terms of certified beds, but also in terms of raising the bar to provide safe, stable, and supportive housing.
Okay, I noticed that Duval County is starting to expand because we've always looked at Jacksonville as, you know, what's going on there. There's a huge population and there were very few certified beds for a while.
Yeah, we have growth areas across the state. So one of the places we just got back from was Pensacola. Pensacola only that region, the Northwest region, only has 3 certified providers, and we have a lot of work to do there. The other 3 for us are Northeast in Jacksonville, where we're about to hire a regional coordinator and open up a satellite office there. And also in the Central region in Orlando, where we're about to do the same thing. And I'll talk about this later in the MAT update, but we're actually heading down to Miami tomorrow to do a presentation. And the southern region is a place that really, really is in need of some more FAR housing down there.
Right. I don't even see what Miami-Dade is 244 beds for 3 million people. That's
That's
kind of
right.
crazy.
That's right. We
Okay.
had a really nice meeting last week with Thriving Mind, the managing entity down there, and all the stakeholders are on board. And it's going to take a big, big effort, but FAR is up for it.
Okay, thank you, Michael. Nancy, I saw your hand up. Did you want to make a comment or ask a question?
Yeah, but then I realized he hadn't done his whole report and I wanted just to give him time to get done with that. But it was very quick because we do have an office. We've had an office in Jacksonville for almost 2 years now, and we have had difficulty finding FAR beds there. And so hopefully we can meet with whoever your new person is and set up something like that.
Nancy, that'd be wonderful.
Team
And
up
thank
there,
you.
yeah.
We
I
had a
have
really nice event in Jacksonville a couple of weeks ago, and the enthusiasm and the support for certifying to a national standard is very high in the community. And
Yes.
we welcome any help we can get. So thank you.
All right.
Okay, great. I guess these are the totals here, and in terms of the growth, and you definitely, Michael, are on an upward trajectory. I don't know, maybe we should get party hats or something when you reach 10,000. But anyway, with that, I'll hand it over to Michael McKeough from Oxford House. It's amazing. I always say this at these meetings. It's amazing that just a few years ago, there was not an Oxford House in the entire state of Florida. And now we're going to get some great numbers from Oxford House. Michael, I think you might be muted.
No, he's. There you go.
Michael, can you hear me? No, we can't hear you. But you don't seem to be muted, though.
No,
Maybe your volume. We can come back to you. Meanwhile, I want to welcome Commissioner Weiss, Palm Beach County Commission, who's joined us, as well as Terrell Pyburn, Coconut Creek City Attorney.
Good afternoon. Thank you.
Well, Michael.
Can you hear me now?
Yeah, I can hear you. Great,
Okay,
thank
sorry
you.
about that. No. All right, I'll jump into it then. All right, so we're continuing to expand across the state. Currently at 258 houses, over 2,300 beds. Continuing to grow throughout many different cities. Continuing to look at some new locations, especially in areas of the state that do not have any recovery housing available now. And so really trying to dive into that. We had one overdose, non-fatal, since our last meeting in Fort Lauderdale. Thankfully, Narcan. Currently, about 70% of the houses in Florida have at least one person using medications for opioid use disorder, which equates to approximately 15% of the members within Oxford houses utilizing medications. We just held our state convention, which we were very thankful to have FAR present. Josh, thank you for coming. But yeah, it was a wonderful event. We covered various topics, really working with our newcomers, fun and recovery, support in Oxford House, and then just like the general operations of Oxford House and maintaining the Oxford House model on a day-to-day basis. And so we were very thankful for that and all of our participants. We got to hear some stories. And on Mother's Day, we closed it out and we got to hear a story of reunification. Mother got her daughter back while living in Oxford House, and so that was really cool. But yeah, I mean, things are going well, continuing to expand and looking at new areas. That's all I got.
Okay, Michael, would you flip back to the top? Just want to take a look at the gross numbers.
Yeah,
So you've got 2,315 total beds right now in Florida,
correct.
258 houses. My math, we're just about at we're just about at 12,000 beds in Florida
Nice.
between you and FAR for certified and for Oxford House, which is phenomenal. I don't think any state comes within 50% of that in the United States. So congratulations.
Thank you.
I always ask you the same question in 2019. That's when you started, right?
Yeah, March of 2019, we opened the first house.
So in 6 years, 258 houses.
Yep.
Incredible.
Yeah, still going.
Okay, any questions? Yes, I see, Michael, you've got your hand up.
By the way, Michael, congratulations on all the success. We consider you to be a major partner in increasing the level of housing in Florida, and to really thank you for the cooperation and the unity that we've been able to establish, and thank you for inviting us to the Oxford House convention. And Josh Thrasher went. He had a great time. We learned a lot. We're going to steal some stuff from you if that's all right. But
Yeah,
I just want to say thank you and congratulations. And it's great working with you.
absolutely. Thank you.
Awesome. Okay, moving on to item number 3, Palm Beach County Healthcare District Crisis Center update. I'm going to hand it over to Dr. Belma Andriek to give us an update on the central receiving facility.
Thank you, Al. Good afternoon again to all. So I have two exciting news to share with you today. So I will share my screen. So first, I would like to share that our community health center dedicated to mental health and substance use disorders located on JFK North Campus actually recently extended hours. So we have now 12 hours a day, 7 days a week, adult and pediatric psychiatric care encompassing all mental illness, including substance use disorders. So we function in this manner as urgent care for mental health. So we are slowly but surely starting to advertise that in all possible avenues, because we think this is important access to care for many people who go without the care in our community.
Hey there.
Sorry, is it somebody talking or it's me?
Yeah, please, everybody mute your computers. Thank you.
So please share this. I will share with Al this in a PowerPoint so he can send to others. But we think this can be important for some of your clients, continuum of care. If you are discharging them from a treatment facility, if you know anybody who needs mental health of any kind, this is very easy access. This also means you can find now psychiatric appointment on Sunday at 4:00. And many people who are experiencing crisis, they can come like 7 to 7 in this facility. It's functioning as a federally qualified health center. That means we see everybody regardless of ability to pay. We also accept most of insurances. We also have pharmacy on the side. Now we give like long-acting antipsychotics injections here. So it's pretty comprehensive care and kind of adopted model what we lost with Jerome Golden Center for this part of the community. So any question about this if I go to next topic? Al, you're muted. I don't know if you're talking.
Sorry. When the central receiving facility opens up, will you be 24 hours, 7 days
Yes.
a week?
So this is outpatient. This is not Baker Act of any kind, right? So that's like very important to understand. This is outpatient psychiatric care with therapists on the side, with a nursing care on the side, integrated primary care. So this is not crisis center, although this is a kind of functioning as a drop-off I believe we now have 5 MOUs with local law enforcement. So this is for the patients who don't fit Baker Act facility criteria, but they're odd enough that the police would take them, or they are like some type of public disturbance that would take them maybe to the jail. So they are giving this as a tool to the law enforcement to have additional tool in their toolbox for those people that are kind of need some type of help, but they're not for Baker Act facility or not for jail. So that's what there is a lot of already drop-offs from the Palm Beach, from the city of West Palm Beach, PBSO, and a few others, among others. Like a lot of public defender now start bringing people here before the discharge. So I think that's another great avenue for that. So they can establish some type of continuum care before they are released from jail if they have mental health diagnosis while in jail. So we work also with public defender office a lot recently.
I know you are cooperating with Rebel Recovery and the Palm Beach County Jail, correct? Are you part of that process?
So we got some referrals from the drug court. We can definitely work on that a little bit more. Nancy, please let us know if we can work on that avenue more. But we do have some.
Speaking of the MAPS program, isn't that right, Al?
Yeah.
Yeah. Yes, we do send some of our participants when they get out, that we do send them for their medication management. If they don't have another provider to go to in the area wherever we are placing them. So in that part, yes, we are working with Healthcare District.
Excellent.
So I think one of the benefits of us discussing those topics is also that we kind of start a little bit shifting in general thinking. This is not only for substance use disorder. This is for all type of mental illnesses. So that's why I'm saying it's core mental health, severe mental illness as well, right? So that's the gap, because of the dual diagnosis and comorbidities, we focus so much on substance use disorder, forgetting mental health. So think of this as urgent mental health care for everything mental health related, including substance use disorders.
Great. Anybody want to comment? Anybody? Now, do you want to? I know at 3:00 you have a press conference. Can you give us can you just?
So I was hoping when I talked to Al, I was hoping I can actually share exciting news about a land location, but it didn't go public yet. I can just share with all of you that we did secure the contract for the land purchase, and it will be public. It will be public next week after our board final approvals. So I can just tell you it's an absolute epicenter of Palm Beach County. It's ultra centrally located. What is was the goal all along. But what I can also share with you, and that's another thing is we are on all that pre-purchasing planning paid off in the sense that we already have a contracted company for project management. We are in the middle of selecting designing team. So like we have 14 different architectural companies apply to our RFP. So like, we're on a very good track to secure that contract. So our closing for the lines should be end by the August. And by the end of this calendar year, we will have also secured general contractor. So it's happening really fast. And by the maybe end of the year, we can share with you some preliminary design concept as well. The good news is, like, I didn't even know, behavioral health facilities are a very hot topic in architectural world. There is a lot of world experts how to design modern behavioral health facility. You will be very pleased how much this field advanced in sense of patient experiences and treating mental health as really with much more compassion and dignity. So all those, we have 14 serious contestants in that, and all of those applications are around that, treating all ages, pediatric and adults, in environment that is much more patient oriented and much less stressful, and provide them really better experiences that we've seen in all type of mental health facility according to them. We'll still, I know we're going to all monitor closely that. What I can share with you today, I'm going to share my screen again, is what conceptually this crisis center facility will have. And you did see some elements of this in the past, but I'll take a liberty again in talking to Al to share with you a little bit again and this is not by any way of means architectural design. You guys can see my screen, right, with the map?
Yes.
Okay, so this is a crisis center for mental health and substance abuse of future that we will design. Those are just elements of care. This is not actual architectural design again. But let's start like just listing those elements in a few minutes. So this will be the police drop-off area. You can see the first responders will be able to 24/7 drop off patients here, both adults and pediatric patients. And that's going to be done. We have some kind of like preliminary pictures how other people are doing that. So some of you who visited those crisis centers, they know that usually those police drop-off has kind of Sally Port area for safe client discharge. This is Baker Act facility. This is actually center for all level of acuity mental health, from spider fears to most agitated patients that are in danger to themselves or others. This drop-off will guarantee 10 minutes for police, and then we'll take of those patients further. We will take care of those patients further. This will have a client storage and the housing, because that's very often kind of barrier for homeless patients. But the heart of this facility that we are very excited is this area in red, what is called like chairs area. Please don't pay attention to those numbers. Those numbers are based on the original feasibility study that we had and beds calculated in Palm Beach County. So those numbers can go a little bit up and down, but definitely all along separation between pediatrics and adults. So those are psychiatric chairs for observations and treatment, both substance use disorder and mental health patients. So somebody who is suffering from substance use disorder and is accepted through either police drop-off or walk-in, the people also can walk in here. That's kind of going to be triage, kind of urgent care setting for people to walk in if they need any kind of help. And some of them will be maybe treated right there and then, but some of them will be accepted to this 23 hours observation area in the chairs designated to SUDs, and maybe medication-assisted treatment will be initiated here. All those urine drug tests will be done here for them. But again, somebody who is sitting in this area is also maybe like acute psychotic patients or severely depressed patients. And again, kids and adults will be separated. So those area looks like very often like this, like with reclining chairs. Again, we are observing them. At this point of time, nobody is Baker Acted. We are trying to really work with them and providing peer support, counseling, as well as psychiatric care and medication right away. 60% of those patients are converted, who needs to be admitted, are converted to voluntary admission if they need to be admitted. So again, that's the benefit of those 23 hours in the chairs, that we provide very robust wraparound services around them, so they don't need to be really involuntary admitted. For those that do need to be voluntary admitted, we have limited number of beds for pediatric and adults. So pediatric beds will be also, I'm sorry, this is like activity room that's going to be for those kids who are staying inpatients. But again, all design will be much more appealing for pediatric mental health unit, including accepting kids with their parents. So if kid has nowadays like any reason for hospital admissions, if they have acute appendicitis, right, and their panics needs to go out, mom stays with their child or dad stays with their child, right? So that's the idea. If the child has a mental health crisis, parents will be able to be with their kids, because again, we are treating mental health crisis no different than any other illness. Kind of cute, this is going to be kind of outpatient area. We plan to have also a kennel, because we know that our homeless patients often comes with animals, and having animals is sometimes barrier to their care. So we will have a kennels that we hope to be kind of some kind of plexiglass, so they can see their dogs or other animals while they're kind of in a courtyard. Very important part of this building will be also moving our Mongolia clinic to this campus. Again, this is outpatient clinic, so people will be discharged to outpatient continuum of care. Again, separation of peds and adults. In pediatric area, we will have child adolescents group therapy as well as group therapy in adults. But this is going to be typical outpatient setting for your ongoing psychiatric and substance use disorder care. Pharmacy will be on site, the same way how we have now at our Mongolia clinic. A long-acting injectable clinic with a nurse. People can just come here for their monthly injections. We dream and we hope we're going to have help of all of you, but definitely space will be secured for the future mental health court. We put Judge Leifman picture here because we want to be like Judge Leifman one day in the future, that we really can have patients who have a peer support here, seen by the judge here, so the peers can help them, give updates to the judge about their progress of recovery, finding jobs and things, and hopefully some of their felonies can be removed by this ongoing process. We will have a space for all of you here, community partners, also intensive case managers here, and we hope that this wraparound services will be really key for connecting them for all recovery-oriented initiatives that we have, agencies who helping them finding jobs, go back to school, connecting them with the hubs. People in hubs can come here and kind of connecting them for the geographically appropriate hubs, etc. So I will stop here. It's a lot of here. Again, this is all that we will be discussing with architects, including their health consultants. All those architects have subcontracted health consultants who are specialized in those kind of facilities. And you're more than welcome to come and participate in some of those discussions that we will have through our public meetings and ongoing sharing information of our progress.
Thank you, Belma. Anybody else have a comment? Yes, Susan Ramsey, you've got your hand up.
This is the best thing I've heard this week. This is really exciting, Belma. I mean, this is a big gap that has been in Palm Beach County for a very long time. So I already asked Michael, Mr. Schlossman and I, who I always agree with, we would love to meet with you as part of FAR. And I'm also on the board of the hub. So all of this stuff, it's a dream come true. It's great. All right, that's it. I'm done.
Thanks, Susan. Okay, thank you, Belma. I know you've got to go to another meeting, and I'm going to try to make it when this meeting's over. But congratulations. This is a great step.
If I can just say, this is the $10 million that county dedicated. This is going to be much more than $10 million. It's just good news is our board secured that money and kind of air that money. That's kind of the most important thing, that we think this is really happening. It's kind of, I start believing in this, Susan, as well. So That's why, I mean, I'll ask me about this. Although it's really crazy day today, I wanted to share those good news for you. So thank you, Susan, for your excitement. I think this is also very well needed. So that motivates us to keep kicking.
Thank you, Belma. And I do want
Thank
to, I want to give a shout out to Commissioner Weiss. He's been very involved in this space for years. He took over for Commissioner McKinley when she left the board. And thank you, Greg. Thank you for all the work you've done. We're moving on to, okay, Houston Park works for DOH, actually as a consultant, I think, Houston. And I just want to give a shout out to Houston as one of the first members in 2016 of the, at that point, it was called the Sober Homes Task Force. And I remember way back when you were piloting along with Dr. Andreek, you were piloting the first addiction stabilization unit concept, which we're going to hear, I hope, a little bit about from DCF during the meeting. If not now, it'll be in July. We're going to get the update on the state where I believe there's 37 counties involved in this, in the core program, which you all started. So congrats on that, both of you. And Houston, you're going to talk about the statewide hospital bridge program.
Yeah. So, hey, thank you. There's a lot of people in this group that were all part of that original team, and that saying that teamwork is dream work really is true. It's everybody here that's participating that's made so much success. But so there's some excitement going on, particularly within our region, which the managing entity covers the 5 counties up to Indian River to include Okeechobee, St. Lucie, Martin, and Palm Beach. There's been a lot of forward progress. So Indian River County just recently implemented a pre-hospital induction of buprenorphine by EMS, and then they're handing their patients off to Cleveland Clinic for a continued level of service and care long-term, similar to the Palm Beach model. We're also seeing that same model being done in St. Lucie County. Martin County is trying to revamp theirs. And just 2 days ago, we had our first patients transferred from Rollerson as a result of Okeechobee fire. So we've got some great things going on there. That model in different forms is being replicated across the state. I believe DCF will have some more definitive information, but the last numbers I heard were that there were 47 counties now following a model similar to the original one from Palm Beach County, providing substance use disorder care. And not only just opiates, but all substance use disorders. So alcoholism, even eating disorders, and dependencies to nicotine or tobacco. So it's really a significant forward model that is also being looked at nationwide.
So could you just expand a little bit about the EMS bridge?
Yes.
What exactly that is?
So, well, I'll bring it right into our own county. The city of West Palm is getting ready to do the same program where their paramedics will encounter somebody that has overdosed or is in need of help, and they will facilitate getting that patient to. Currently, it will be JFK North as one of the original addiction stabilization units. The goal there is that once they get into the ER, they're directed into a level of care and medication for long-term health through the healthcare district and through the managing entity. The city of West Palm is also looking at doing pre-hospital induction so that when we encounter a patient that has overdosed or been reversed, and they're receptive to the treatment, they are given a dose of buprenorphine before they arrive in the emergency room, which then helps stabilize their mental thought process so that they're more receptive to learning about the treatment plans that are available for them instead of them getting up and walking out of the ER. So that's a real significant push. Dr. Shepke has promoted that statewide as the Deputy Surgeon General under Dr. Latterpole. And so we're really seeing amazing results with patients being treated. And it's also helping with reducing the stigma, and the EMS providers are really starting to understand that this is a true medical disease, no different than hypertension, diabetes, or any other challenge. And so it's being treated that way and not necessarily caught up with the stigma that goes with it.
Thank you, Houston. I see Nancy, you have your hand up, please.
I just wanted to add, Rebel Recovery and Southeast Florida Behavioral Health Network. We will be providing the peer support services for the core program here in Palm Beach County, and meeting people after they have gone to the ER, or Houston and I are meeting tomorrow to decide what the program, how our role will fit in. And it comes from our experience we were the part of the original pilot that started with the heroin overdose task force, the one you were talking about, Al. And Houston and I used to do a lot of riding around together. So we worked with Healthcare District, CEFBN, JFK South, and Palm Beach Fire Department. So I'm very happy to do that work again. We are here at Rebel.
Yeah, and hey, Al, I got to tell you that Rebel's model has been replicated throughout the state now. There are other providers. We have a different provider in the northern part of the counties that are covered, but that model works. And I've said from the beginning that had we not had Nancy at our side convincing patients to become part of this program, we would have never had success. And we're seeing the same thing occurring now in Indian River and St. Lucie counties, where the peers literally are the connection to these patients having a positive outcome.
That is the bridge, peer support.
Absolutely, 100%. So,
and Nancy, pat on the back to you and Rebel. I know
we try.
Yeah,
we try.
And I do want to say one thing also, that the model now has been seen and is referred to as the Palm Beach model, with grants that are being made available nationwide through the CDC. But places like New Jersey and Rhode Island have really stepped it up with their pre-hospital inductions of medical assisted treatment as well. And so it's just really rewarding to see that, it's not just us here in Florida now, but it's the rest of the country starting to pay attention to this. And according to SAMHSA, it is the gold standard. So as many can remember or don't know, but before people had automated external defibrillators, AEDs, in public places, if somebody had a heart attack, their chances of survival were much less. And then it became a golden standard that in all public places, there was an AED available in the event that somebody had a heart attack. Well, we're now starting to see the same thing with the availability of Narcan prevalently throughout the communities. And you're going to start to see EMS providers following a standard of care where they're following the standard that is the gold standard, and so are the ERs. And if they're not doing that, then it could be considered right on the edge of a liability or negligence. So it's going to have a positive outcome.
Wow. Dr. Andrew.
Yes, kudos to all those pushing the core model. I just want to emphasize the reason why the state really copied our model is that continuum of care. But that pre-hospital crisis addressing and engaging patient is absolutely crucial. The keys for success is connecting them to ongoing treatment. This is lifelong illness, relapsing illness. And the reason why the core is successful across the state of Florida, community find a way to find who is that warm hand of place to receive the care for the rest of their time. So I think that's kind of I think a lot of communities are finding good solutions for engaging people. And pre-hospital administration of MAT that New Jersey is doing is something that Chief Coyle is also exploring for a while now. But that continuum of the treatment and outpatient ongoing care is absolutely instrumental in those models. So I hope that City of West Palm Beach I mean, I talked to their chiefs and like, finding that medical home for their mental health is absolutely must.
Thank you. Thank you, Belma. Okay. Thank you, everybody. Let's move on to, I don't know if DCF is on this call. I kind of blindsided them last week because I only found out that they had taken over the core program from DOH when I talked to Dr. Shepke 2 weeks ago. So I gave him very short notice. I don't know, is there anybody here from DCF wants to talk about the core program? We will put it on the agenda for the July meeting, and we're going to get an update from DCF as to what they're doing, what they're not doing, what they need to do, and be able to give them some input from our perspective. So tune in. Please, come to the July meeting. Do we have a date?
July 9th.
July 9th. We may have to move that a week later.
Okay.
Okay, but it'll be in July before the middle of the month. Let's move on to, again, to Michael Schlossman and Josh Thrasher from FAR. And let's talk about the MAT bed capacity statewide, what you're doing with education and how that's working out.
Great, thanks. While we're getting that up on the screen, Dr. Andrich, I just wanted to congratulate you. That is wonderful news, and we look forward to meeting with you and working with you. So thank you. And if I can, just for a second, Al, I wanted to echo your comments to John Hewlick and thank him for his years of service. And John, we look forward to continuing to work with you. And you've been so instrumental here in Palm Beach County. And so thank you for that. All right. So as you all know, FAR received a state appropriation for the first time in our history. We also have a Palm Beach County grant, and both have the same aim, which is to increase MAT bed capacity across the state. So if we can go to the next screen.
And while we're going to the next screen, I do want to give a shout out to Tori Perfetti and Zach Hubbard, who were instrumental in getting that across the finish line, that money across the finish line in the last legislative session in 2024.
Thanks for that, Al. So we've been educating people about the new legislation, and most of you know it's in 397-487, paragraph 13. And it addresses this not in a mandatory way, but in a form of anti-discrimination. So as of January 1st, which is now a couple of months old, a certified recovery residence may not deny an individual access to housing solely on the basis that he or she has been prescribed federally approved medication that assists with treatment for substance use disorders by a licensed physician, a physician's assistant, or an advanced practice registered nurse registered under that section. So there's been a lot of confusion. There's been a lot of questions. There's been a lot of fear. There's been some pushback, not as much as we expected. And if we can go to the next screen. So as I said, we've been crisscrossing the state. And one of the first things we did at FAR back in July was we separated the state into to mirror the 6 DCF regions. So we've been all over. We're down in region 5 tomorrow. And if we can go to the next screen. So far we visited in this.
And they are still on.
In this budget cycle, we visited Port St. Lucie, Fort Lauderdale, Palm Beach County, Tampa, Jacksonville, Sarasota, Pensacola, Venice, and Orlando. We have reached out to, our goal is to reach out to about 4,000 to 5,000 people by the time we're done. This past a quarter, our estimates are that we reached over 1,500 people. We have Miami coming up tomorrow and New Smyrna Beach next week. And then we wrap up this session at FAU. And I really wanted to invite everybody to attend that FAU presentation. It's from 10 to noon on June 18th. And we would love to get everybody out there. So if we can go to the next screen. And this is the invite for tomorrow. If anyone is in Miami or is interested in coming and meet us, it's down from 10 to noon tomorrow. And if you need the address, we're happy to give that to you. You can also go to the FAR website. And if you haven't been there lately, check it out because it's all brand new. It's beautiful. It's very intuitive, very easy to use. And if you go to the calendar, you can see all the events coming up and easily RSVP for any of the events. So if we go to the next one. So additional touch points of outreach aside from our brunch and learns have been what mandatory quarterly meetings with all of our providers, email blasts, monthly newsletters, our new website, which also has a new video up on it. If you haven't seen it yet, it's wonderful. It has Courtney on there doing a really good presentation on medically assisted treatment, what it is, what it's not, how to answer some questions. We've been doing a lot of one-on-one meetings with providers. And also we are now an accredited provider of CEUs to CRAs across the state. And so we've been giving out CEU credits for that. If we can go to the next screen. And a lot more to come. So we have come a very long way in our goal of increasing MAT bed capacity. And the question always comes up do we have everybody on board? And the answer is simple but complex. When you agree to be a FAR certified provider, one of the things you agree to in our certification agreement is to comply with all local, state, and federal regulations. And of course, this is now a state regulation that you can't discriminate against someone solely because they're on a medication to treat substance use disorder. With that said, we don't have cameras or listening devices inside of the houses, and we don't know what goes on. So it's critically important that if you have information that there is a FAR certified provider who is not complying with this, to let us know. There was a secret shopper in the past, and I believe there's another secret shopper floating around. And I just want to encourage us to break down the silos and work together because our goal is 100% compliance and nothing less than that. But the only way that we find out about these things are from grievances and incident reports and reports from other providers and from stakeholders. And we're really all in this together, and this is a community effort. So we have poured our whole heart and effort into this. I think that the battleship was not as hard to turn as we thought it was going to be. But of course, there are abuses in the system and some people who just refuse to comply. And we're trying to diligently work with those providers and those individuals to make sure that they do comply with this very, very important legislation. So thank you, Al.
Thank you. I don't see any hands. Does anybody want to comment or ask any questions? By the way, Michael, great job. I mean, you guys your footprint in the state compared to what it was 5 years ago is incredible.
Thank you.
The law is the law and you can't discriminate. I see John Hewlick has raised his hand. John, please.
Yeah, thank you, Al. And I just wanted to echo that. It's been wonderful, at least in my tenure with the county, to partner with FAR on the MAT initiative. The collateral and the education they're undertaking now is incredible. Michael or Angie, if you could put the link into the video with Dr. Phillips, which is very well done, very professionally done. Please do that. And I wanted to echo your sentiments, Al, to witness and then to see the meat behind the complete turnaround for FAR over the last couple of years under Susan Ramsey, Michael's leadership, their board. I am just we should all be proud. They're obviously Palm Beach County based, and they've come a long way through their leadership. So I just wanted to echo that.
Thank you, John.
Thank you, John. I will be sending a check to you in the mail. Appreciate that.
Double the salary, right?
And Al, let me add one last thing is that and John prompted my memory on this. Along with this goes hand in hand RCI and implementing RCI across the state. As you all know, anytime you want to give an opinion on something or ask for funding, the question always is, well, show me the data. and the data in this area is severely lacking. So we have taken, there's a NAR standard, and it requires our providers to engage their residents in in recovery capital. And so we have made a large effort of making sure that our providers are following that NAR standard. And the one that we are providing to our providers free of charge is called the Recovery Capital Index. And but they're open to use any tool that they want. There's great tools out there as long as we get the data and we're able to keep track of all these things. And well, Al, we have followed up on getting vacancy numbers and getting that system in place, and we're working on that right now. Because in addition to our website being completely redone, our certification portal and how we interact with our providers and keep compliance is about to undergo a revolution. We're leaving an old existing framework that, believe it or not, is housed right outside of Moscow, Russia, and we actually just contracted with a new company, and we're working on building out that system and migrating the data over. And so we'll have many more touch points and a lot more data than we had in the past.
When that came up during the legislative session about bed availability and whether we're overtaxed, I remember talking to Michael McKeel, and they have a daily update, I believe. Is that right, Michael?
Yeah, so it's daily. As soon as anybody comes in the house or leaves the house, they can text a specific 5-digit number and it will update the website. But it's also asked weekly for every house.
So I don't know if that would be, their system would be helpful for FAR. And I don't know whether you all have been in communication about that, but might be a resource for you to, to get that real-time stuff going.
We have, and Michael mentioned that on the last task force meeting, and so it prompted a conversation between the two of us, which prompted us to add this into the renovations that we're doing on the current system and make sure that we get those numbers for everybody as quick as possible.
Great. And you go ahead. Sorry.
No, just appreciate it, and I appreciate Michael's help.
Okay. And the RCI, are we getting any data now? I mean, when is the time for us to have that discussion? In other words, when would you like to tell us about the strides forward on recovery capital data?
Yeah, no, good, Al. The data is being collected right now. It's not coming in as fast as we would like it, not because of efforts, just because of old habits and getting people to do it. But like I said, it's become a compliance issue now if they're not using any kind of recovery capital tool. And so slowly that battleship is turning a little bit more slowly. But really what's going to happen is all of this data is going to be compiled into a study that we commissioned FAU to do. And so the results of that study, I believe, Angie, will be available in July or August. Am I correct?
Sorry, probably by July 15th.
Okay, by July
after
15th.
July 15th, yeah.
Yeah. And so it's one of the things that we're going to be talking about at our FAU event on June 18th, because we envision working very closely with FAU on a future study that we have some other things that we want to do.
Well, maybe we can move our July meeting back to after the 15th of July. But that's cutting it close. Maybe we'll schedule it a presentation in September.
Yeah.
How's that sound?
That sounds great.
All right, great. John, you have your hand up.
Yeah, if I could just real quick out on that point, as you know, the county has made a major investment in resilience recovery capital indexing. The master plan reported on the data since inception of the deployment of that instrument back to 2019. The first and foremost forefront of that is the ability to identify risk and resilience factors. But the county also receives what we call intelligence summaries from the vendor. So a lot of different perspectives with respect to that data. Also, the county, as you might recall, partnered with Rebel with a federal research project. So in partnership with FAU have collected quite a bit of not only data, but published on findings related to that, findings that really were the driver for what you found, not only in the master plan, but subsequently in the NOFO. So it won't be me, but working maybe with Michael when they're ready to report on their RCI data is to also take a good look at what's been produced by the county on the recovery capital front.
Great. Thanks, John. Okay, let's move on to legislation. That's our last.
Al,
Yes.
if I may, I can't find my little hand to raise, so I apologize.
Oh, that's
The
okay.
Dr. Courtney Phillips video on MAT, I posted it on the chat. It's only a little under 7 minutes. It's really wonderful to watch. If anybody wants to watch it, that would be great.
Thank you, Angie. I appreciate that.
Okay.
Okay, we're not going to spend a whole lot of time on legislation at this session, but I will tell you things will be moving fairly fast. I do want to talk about the legislation that did pass this year regarding recovery residences and reasonable accommodation, as well as the certified recovery residence administrators. I was hoping that Neil McGarry would be on, because he's the Florida Certification Board. But this is going to be ongoing. Also talk about, and we'll lead with this, talk about the legislation that we submitted this year that for reasons beyond any of our control was not able to go through the legislature. And lastly, our Chapter 419 rewrite that by the time it was written from the study, it was too late to get it into this legislative session. So we will be bringing it back to the legislature. And I really, really want to get input from people who read the 419 rewrite. We'll get to that in a minute, as to how we can make it better or what the problems may be with that legislation. But first, let's just briefly go over this year's legislation, because we'll be reintroducing it next year. And Michael, again, this is the Michael Schlossman show for this task force meeting. So I'll give you the floor on that piece of legislation, which was in your packet, SB 464.
Right, and thanks, Al. So yeah, we did have some legislative initiatives that we put forward for this year, which unfortunately haven't really been able to gain traction. We do have a very comprehensive package for next year, and so we're looking to roll this into it. There were two main changes that we had suggested back in last June. Florida had codified the 4 levels of FAR certification, and we're actually the only state in the country that has the levels of support codified. And so it changed the way that FAR certifies providers, in the sense that in the old days, you used to come to FAR and you would tell us what level of support you'd like to be, and then we would certify you to that standard. But now there's statutory requirements that have to be met, and so that's changed the way that we look at it. And we were having some difficulty in some language that was in the level 4 statute, which was being interpreted as one thing by providers and by another thing by us and those who wrote the legislation. And so we were looking to take a couple of words out and add a couple more words. And so we're going to repropose that for next year as well. The other thing that we were hoping to do, and we've had a lot of discussions about this with the managing entities, is there's an existing exemption in state law of FAR certification is exempt if they receive money directly from a managing entity. And so we had offered, in exchange for eliminating that exemption, to waive the fees for certification to sort of soften the impact. And again, with the goal being to increase the standard of stable, supportive, and supportive and housing, to make sure that that even those providers are certifying to a national standard and being inspected and audited and all the things that FAR does to ensure the residents' safety. And we had great response from that from most of the managing entities. but it sort of went down with the whole bill due to some political implications.
Okay, that is here on line 54 and 55, where we took out the exemption from the voluntary certification law, which says if you refer or accept referrals, you must be certified in order to do so, and they were exempted. They meaning recovery residences that were under contract with the managing entity. And one of the things was kind of weird in a Kafka way, was that in order for them to get vouchers, a recovery residents would have to be certified. So in order for them to be under contract with the managing entity, they should be certified already. But since some of the programs were not, maybe some of the different areas, the different managing entities across the state were not enforcing that rule. I know we weren't. Ann Berner was here in Palm Beach County. She won't give out a voucher to a non-certified recovery residents. And maybe in some other areas they were. But anyway, this would close that loophole. So if you're referring or accepting referrals, you're certified. So the other one you were talking about, this was really willful knowing and intentionally, you didn't want to, and correct me if I'm wrong, but working with you, Michael, you didn't want to have to revoke a certification if somebody was a really good provider, but they had provided misleading information, and they can, and there are reasons. So
That's
the way
right.
the
We wanted a
statute
little
is,
bit more regulatory discretion.
yeah.
And
So
the
that's
statute.
why it's got to be willful, knowing, and intentional. If it's something that just passed through under the radar and it was false, but they didn't catch it, your hands are not tied. And the last one was the level 4 that you mentioned earlier about the staffing. And I think the law this year clarified that with the CRRAs, if I'm not mistaken, that when somebody's at the residence, it has to be staffed.
Yeah, and this also, as you know, if a provider has a day-night with community housing license from DCF, that community housing must be FAR certified. That was established a long time ago. There's a loophole going on with folks who have a day-night license and then have a separate recovery residence that is essentially trying to outwit the day-night license with community housing so they don't need to be FAR certified. So one of the reasons that this was put into statute was to close that loophole and indicate that where there's a provider-driven decision on where the client was going to be housed, it would have to be the highest level of FAR certification, a level 4, which meant that they had to have 24-hour staffing. And so there's some squabbling about the way that it was worded, and we were trying to clear that up.
Thank you. Yeah, and that is important because people were not certifying, basically saying that my patients can go anywhere they want to, but everyone in that house is going to that level 4 provider.
Right.
So,
The evidence shows otherwise. So.
right. Okay, great. Thank you, Michael. And that will be part of the legislation. Get it in soon. If you have other legislation, FAR has other legislation you want to recommend. And now let's put up the SB 954. And while we're doing that, I want to give a shout out to Dave Ehrenberg, who was going to be at the meeting today. Obviously, he's no longer my boss and no longer in charge of the office and the task force. But he just wanted to let everybody know he's alive and well and still in the space. So just wanted to recognize Dave for all the good work he did over the 9 years that the task force has been in existence. Speaking of legislation, I think it's been 7 out of 9 sessions that we had task force legislation pass in the Florida legislature. Pretty good track record. Okay, this next one, and I'm sorry that I did get a note from Jeff Lynn that he couldn't be here. I did want to get his input. This is legislation that did pass. It basically sets up a system where, and I'm going to read this lines 37 through 43 because it's the heart of the matter. By January 1st, 2026, the governing body of each county or municipality shall adopt an ordinance establishing procedures for the review and approval of certified recovery residences within its jurisdiction. The ordinance must include a process for requesting reasonable accommodation from any local land use regulation that serves to prohibit the establishment of a certified recovery residence. 419, which we were pushing, but we didn't get it in form yet in the past legislative session. 419 goes further. It not only talks about reasonable accommodation, but it also sets up permitted use. You know, imagine not having to go through the reasonable accommodation process in a municipality or a county, and being able, as a matter of right, if you're certified, number one, and there's a slight distance, 660 feet, which is basically one block from another certified or another community residence, either certified recovery residence or other disabled family residence. We didn't get that through to the finish line. We're going to try again next year. I think we will have support from the League of Cities and Association of Counties. And this is statewide. This is not just Palm Beach County. So it's not just one municipality like Delray Beach or Coconut Creek or Pensacola, where they have similar ordinances to the model ordinance that we're trying to get into 419. And the one other thing I'm going to say about chapter 419, for those of you unfamiliar with it, it's the one chapter in the Florida law that deals with community residences with people with disabilities. However, the law was first passed before substance use disorder was a disability. So you have mental disabilities, you have physical disabilities, you have different government agencies that license these different community residences, but nowhere is there recovery residences because, again, when the statute was first established, they weren't even thought of. There was no FAR, and there was no disability connected with substance use disorder. It was called substance abuse. It wasn't even called substance use disorder. That has changed, so 419 has to get kicked into the present. And not only do recovery residences need to be included, but all residences, family residences, that now are reasonable accommodation, all of them really must, we really need to have a statewide process that's not different from municipality to municipality, where you can locate, where you can open up a certified recovery residence or a licensed, house for persons with a disability, et cetera. So that's the background on 419. Getting back to 397, 487 and the changes in the law. I don't know, Terrell, would you like to, or Susan, would you like to chime in and talk about a little about what this does?
When you're talking about the changes in the law, you're referencing in Senate Bill 954?
Yeah, we're on 954. We're going to go to 419 next.
Yeah, just because you kind of jumped around. I just wanted to be sure. So as you pointed out, it just requires that municipalities and counties must have a reasonable accommodation process. It also requires that timeframes must be followed. So essentially every local government that receives a reasonable accommodation, and in the context of recovery residence, usually that's an accommodation to either exceed the definition of family or basically to house more people than maybe the standard housing code would normally allow. And so essentially they have to time stamp or date stamp the application upon receipt. and then they have to make a final determination on it within 60 days. If there are, and the only option for the final determination really is to approve it in whole or in part, with or without conditions, to deny, stating the specificity as to why with evidence-based reasons. Those are the only options. If for some reason it's not approved within 60 days, then it's deemed to be automatically approved. So in other words, let me try that again. If it's not approved, if there's no response within 60 days by the local government, then it's deemed to be automatically approved. If, let's say, the local government just got busy and failed to respond. There are some requirements with regards to minimum requirements for what has to be in the application for the reasonable accommodation, such as the name and contact information, property address, a description of the accommodation that's requested. The local government can, in their own ordinance, establish additional requirements for review or approval of the accommodation so long as they're consistent with this statute, meaning that it meets the time requirements and that it at least, includes this minimal information that is required. And every local government has to pass such an ordinance if they don't already have something that's compliant with this by January 1st of 2026. The ordinance also cannot require public hearings beyond the minimum required by law to grant the requested accommodation.
I'm going to interrupt you there, Terrell. Do you know what this means? Because I don't know what this means.
Which section?
D, 81 to 83. May not require public hearings beyond the minimum required by law to grant the requested accommodation.
Sure. So what that basically means is that I think that's a holdover from an earlier version of the draft amendments to this statute, because there was some back and forth, as I understand it, where I guess there was some language saying that basically they were trying to prohibit public hearings on reasonable accommodations. But the issue came up that to the extent that there might be the need to have a hearing, maybe there's a unique situation, or maybe the local government's code provides for that, you have to allow it to be a public hearing. You can't just have a hearing where only the board members speak under state law, I forget the exact, it's under chapter 286. It requires the public to be able to speak on the item if the public can speak on any item at that meeting. And also, in full transparency and fairness, it would make sense for the public to also be able to speak at those meetings to the extent that you're going to have it go before the board.
It's a sunshine law issue.
Exactly. It's a sunshine law issue. That's why it's referenced there. It's just not as clear as maybe it could have been, because like I said, I think that's a holdover from some earlier version that I saw floating around. So it does provide that the ordinance may provide for revocation of the accommodation if there's a violation, if there's a lapse, revocation, or failure to maintain certification or licensure, and it is not reinstated within 180 days. It basically has citations just to the Fair Housing Act and the Americans with Disabilities Act. It does provide also, I'm going to say kind of strangely, that the application of this section does not supersede any current or future declaration of condominium under Chapter 718 or any HOA documents under Chapter 720. And so what I think is intended there is for them to say, look, if let's say hypothetically you have condo association documents or homeowners association documents that say that you can't have any rentals at all, or you can't have any rentals in the first year, this doesn't circumvent that. That said, we all know under the fair housing law that whether you live in a condominium association or a homeowners association or not, the Fair Housing Act still applies there. And so there still would be the ability to seek a reasonable accommodation. It just doesn't supersede any of those laws, if they have regulations with regards to rentals. That's the way I would interpret that. I just, again, don't know that's totally clear.
Yeah, I can't understand what that means because, okay. I mean, if they have a declaration that they don't allow group homes, that would be in violation of the ADA and the FHAA.
Right.
Agreed.
And then
So
you're saying with the way you read it is, if they have any like tweaks that are reasonable, like you can't rent, if everybody is bound to the same rule that you can't rent a property for a certain amount of time,
or it might be
this would apply.
that there can be no more than 20% of the units are rented or something like that, and it applies across the board. You know, I think that would still be applicable. But it doesn't allow them to just circumvent the Fair Housing Act.
Got it.
And I forgot to mention, so if it's not, if a response is not given by the local government within the 60 days, it is deemed approved. However, the local government has 30 days to essentially ask for more information if that's necessary.
Yeah, I was going to bring that up because if you look at lines 52 to 56, the application is in when it's in and it gets date stamped upon receipt. That starts the clock for 60 days as I read the legislation. So if additional information is required, the local government must notify the applicant in writing within the first 30 days, after which the application has 30 days to respond. To me, that's 60 days. So the process is not done even within this reasonable accommodation process in time for the local government to have a reasonable amount of time to deny or approve the reasonable accommodation. I think this may turn out to be the Zoning Lawyer Full Employment Act of 2025. I don't know what your take is, or anybody else, Susan, anybody else who wants to venture a guess. This may be something we need to go on next year and fix.
Possibly, it is a short time frame.
Yeah,
but you know, a lot of this is good stuff because there is one of the problems in Florida right now is every municipality has a different rule. Every county has a different rule, or potentially has a different rule. So reasonable accommodation is not consistent within the various local governments, and this at least gives some guidance and some uniformity to a reasonable accommodation process, which is a very good thing, which, you know, as part of the entire picture. Would you agree, Terrell?
Yes, I would agree. It does give some guidance. It is also, you know, on that basis, it's helpful, I think, for some of the local governments out there that don't really have a process in place. It is kind of forcing the issue and making them adopt a process. That said, there are many local governments that do have a process, and some of this language may conflict. Obviously, to the extent of any conflict, as the statute says, they will have to change their code in order to be made consistent with this new statute. Probably they won't have to make a lot of tweaks or changes, though, because I believe that other than the time frame and the fact that you just have to have a process and some of the minimum requirements that are referenced in the statute, there is still some flexibility for local governments to be able to add in some additional language. For example, I know that many of the cities that have adopted an ordinance based on Daniel Lauber's studies have adopted language requiring that in order to exceed the definition of family, that there has to be proof of FAR certification. This doesn't really specifically require that, although it does say that you have the ability to revoke it if the certification is essentially revoked in some way or lapses for a period of more than 180 days. That said, I realize on its face that this statute only applies to certified recovery residences, so there would be no prohibition on local governments putting in language requiring certification. So it kind of goes hand in hand.
Right. Yeah, I think the one glaring issue is the time frame, whether it's a reasonable amount of time frame. Anyway, anybody want to comment on this further? This is the law unless it gets vetoed. I mean, and I haven't heard anything that it's on anybody's radar, but it's been passed in this past legislative session along with 15 other bills. That's kind of a joke. But very few bills got passed this year because of, I don't know.
Apparently it's a rule, Al.
What's
Not
that?
all bills can be passed.
No, but this year there was not a lot of cooperation between the
Understood.
branches.
Yes.
Okay, so anybody want to comment on this? And we'll go to the last item for today, which is Chapter 19. Not going to spend a whole lot of time on it. Kind of already mentioned it, but for those of you who may not know, Florida commissioned a study. I would say the foremost expert who is not attached to any particular interest, but just somebody who has been doing this for 40 years. Was the one who did the study, Dan Lauber. He couldn't be here today. He's traveling. We will either in July or if necessary, we'll come up earlier in June. But in the July meeting, we're going to discuss this. And I'm going to try to invite as many people who may be opposed to the 419 rewrite so that we can at least get their suggestions and have a debate or a conversation, not even a debate, but a conversation about where this it falls short. I know there's some economic interests that feel that this doesn't go far enough, although I will tell you, nowhere in this country, I believe, nowhere in this country is there a permitted use system like the rewrite of 419 allows. And what I mean by permitted use is anybody who is on this meeting, on this Zoom, that owns a recovery residence or ever has owned a recovery residence or deals with recovery residences know what a pain in the, okay, I'll say neck, we're being recorded, what a pain in the neck it is to have to go through reasonable accommodation. And every single recovery residence, unless a town or county does not have a cap on unrelated adults or does not have a definition of family, and then you can go anywhere you want. The reason is you cannot single out recovery residences or other community residences to discriminate when others in that residential area, whether it's multifamily or single family, where others are allowed to do it. So if you don't have a cap on adults, on unrelated adults, well, somebody, can have a family with, or just have a house with unrelated adults as many as they want. But if they call it a recovery residence, all of a sudden they can't do it. No, that's on its face, it's discrimination. So it's those areas, and most municipalities, I think, do have a cap on unrelated adults. No more than 3, no more than 4 unrelated adults. And that's when you have to go and ask for what's called a reasonable accommodation. You have to ask the government to go through an entire process and pay fees so that you can be able to locate a community residence in a residential or multifamily area. What this 419 rewrite does is for most community residences, it's a matter of right as long as there's not like 16 people living there, unless it's a recovery community. But it really does, meet in the middle of what is wrong with our zoning processes. And again, for some, it doesn't go far enough, and we'll need to hear from them. This is an open, discussion. But right now, what a wonderful world it would be for people trying to, for an Oxford house, Michael, if you want to chime in, how difficult it can be sometimes because you got to go through a zoning process where you can just locate a house and you just put in, it's a permitted use. You don't have to go through a zoning process. You don't have to spend the money. So anyway, we'll be talking about this a lot between now and the next session, because this is earth changing. This is a real deal here. It does change the landscape. Florida has always been at the cutting edge of being able to meet the good citizens, the good people with the pitchforks and the torches that I refer to, and people who are in the recovery field or other fields that deal with disabled, people who want to live in a community and have to go through the tortures of the damned. And certification has been one of the seminal moments where, people now in communities are not going to have the Delray Beach issue that happened in 2015, 16, 17, where, anybody who wanted to rent a house started renting out rooms and calling themselves a recovery residence, and nobody could do anything about it. So anyway, I've just speechified, and I apologize to everybody. I'm very passionate about this issue. I want us all to get along and make a better mousetrap. So that's my preamble. I won't give that speech again. Anybody want to comment on that? We got Anthony Photo, who tell us about yourself, Anthony.
Hey, how you doing?
Who are you?
I am one of the network integrity managers working for Southeast Florida Behavioral Health Network.
Cool.
And this is not so much about Chapter 419, but I did drop in the chat an in-person meeting for Palm Beach County Core, which is coming up next month on Friday, June 20th. I've been working under Amanda Busman, kind of spearheading this project in our network. So my email is in the chat, and if anybody has any questions or is interested in some stakeholder discussion or partnership, please feel free to reach out to me.
Thanks, Anthony, and please send my best to Ann Berner. We missed her this week.
Definitely.
Okay, Susan Ramsey, you've got your hand up.
Yes, I do. Susan Ramsey again. I'm everything that you said. I'm not going to repeat it, but I think one of the problems in Florida and throughout the state is this issue of some places yes, some places no. And it's a big burden for the operator to have to hire lawyers to, have these fights. And it's, lawyers ain't cheap. So if it's a matter of right, and it's all within, and they're FAR certified recovery residences, so there's checks and double checks, to ensure that they're acting as a good neighbor and they're not overcrowding the house and that kind of thing. And are there some compromises? Yes, but I think this is an excellent thing, and I feel as you do, Al.
Thank you. I want to read one part of the current statute. All this stuff that's crossed out is actually in law right now, and we're trying to strike it all and start from scratch with how we deal with community residences of all types, and including including recovery communities, which can be over 100 people. Okay, but let's just look at this one sentence on 116. A home that is located within a radius of 1,200 feet of another existing community residential home in a multifamily zone shall be an overconcentration of such homes that substantially alters the nature and character of the area. A home that is located within a radius of 500 feet of an area of single-family zoning substantially alters the nature and character of that area. That is patently violates federal law, but think about it. That's the state standard. There would be a lot fewer recovery residences and a lot fewer Oxford houses, certified recovery residences and Oxford houses, if this was followed by most municipalities. Because what we're doing with 419 is we're reducing the spacing distance to 660 feet, which is one block, essentially. And we're making anyone that's more than 660 or more a permitted use. And then if it's less than 660, you can go in for a reasonable accommodation, which you can do now anyway. But the way the statute reads right now is completely unacceptable. You can't locate a recovery residence within 500 feet of an area of single-family zoning, because it substantially alters the nature and character of the area by law. So anyway, again, sorry for the redundancy, but that's what we're trying to change. We're trying to move the bar forward. Is it perfect? Probably not. Alton, you wanted to say something?
Yes, Al, it's not on this particular bill,
Okay.
but just in general, do you think it's possible for us to find someone at both the federal and state level within the next 2 or 3 months to come to the meeting and discuss what's happening at the federal level in terms of proposed reductions to behavioral health? Some of them are pretty draconian, like stopping all funding for Narcan, uh, opioid drug testing, uh, treatment, and other kinds of things, housing for individuals with mental health and substance abuse, major change to how housing requirements can be met. But the biggest one that's going to have the most disastrous effect on Florida and therefore behavioral health is cutting $900 billion from Medicaid. They are discussing those issues right now for October 1. And I just think since those things are going to upend whatever we're planning locally, if those draconian cuts go into place, um, it seems to me it makes sense for us to start talking about potential contingency plan because it's going to be hard to do whatever we want to do if the kinds of things they're talking about go into uh, effect. And I just thought it might be helpful if we talk about it from the federal level. I mean, just the cuts to block grant alone, which is what they're talking about, will affect the whole care system. And then talk about what Florida's position in response to what they're talking about now. So is
Alton,
that possible?
Alton, that's an excellent point. And you're segueing into the good and welfare, which is great because we're done with the legislative stuff. Um, and, uh, and we'll X out of that now. But I will tell you that I was in communication with the DOJ people that are in the department that the anti-discrimination department. I can't remember what it was called now. Um, they were going to come and talk to us about what they do, what they consider reasonable accommodation and the services that are available if you're being discriminated against. And guess what happened? We had an election and I got ghosted. And I understand they said, don't name my name. Everybody in the federal government is on chopping block right now. Nobody's going to step forward. So when you're saying somebody from the federal government, ain't going to happen for two reasons. Number one, if they support cutting draconian cuts, they're not going to want to say it publicly. They're just going to want to do it. And number two, if they're against it, they're not going to say anything because they don't want to get fired. So, but your point is an excellent point. And please, anybody who has someone that is in this space, and I'm talking about federal funding, that you feel is an expert and you think can tell us the truth and let us know what if we do have a bad patch, what it's going to look like. Let me know. Just email me or email Mary Ann. I'll talk to him, try to get him to talk to us at the next meeting or the meeting after. I share your fear, and I would recommend, and I'm not political at all, and this meeting should not be, and it won't be. But I would say, with regard to cuts for services, everybody on this meeting should be talking to their representative and talking to their senator and talking to their offices and getting your friends and your neighbors and other people who are in the community to reach out and say, what are you doing? Because none of us know. We don't see beyond the veil of what are going to be the cuts. I mean, yeah, we don't know what those cuts are even going to be. But the ones they're talking about, Alton, you are so right. Putting this off on the state and having no more federal funding is going to be really, I'll be delicate, detrimental to the recovery to the recovery industry and patients that are in recovery. And Susan, you had your hand up, I think? No?
I did. I'm a member of the American Health Lawyer Association or something, but anyway, I'm in the Behavioral Health Committee, and I'm not an active member, but there are active members, and they're starting to put out articles about exactly this, the effects of the funding on all different agencies throughout, especially the behavioral health space. So I'm happy. I'll reach out to you and I'll reach out to them to see if somebody wants to talk to you and come here because they're really up on this,
Great.
unlike me.
And Susan, send articles to me and I'll send it out to everybody.
Yeah,
Well,
I'll look
better
today.
yet, Mary Ann will send it out to everybody. But please do, because this is very, Alton, 100%. This is very important.
Yes,
because this is our next several years. It may not affect us in the budget for the 25-26 budget year, but if these things go into effect, it is really going to hurt. Anyway,
and we're reaching out to Lois Frankel to see the next time she's in town, whether she will talk to our group about what she sees happening. And the last thing I'll say, Al, if you care about homelessness, President Trump gave a speech in California. The philosophy of homelessness, if Congress agrees with him, will be significantly changed. I mean, the whole doctrine that homelessness groups are working under right now is going to be completely changed. He has a different philosophy about how to deal with the homeless and how to direct federal money in support of that. So I just think, before we wait until it's thrust upon us, if we can talk about it, talk about contingencies, be aware of it. I don't know what we can do about it, but at least we need to be aware of a tsunami that will come our way if Congress approves.
Well, Alton, again, well said, and I hate to end the meeting on such a downer, but it is what it is. I mean, we have to face this, and it's better to face it with open eyes to see what contingency plans we can come up with. This is important to the county. It's important to the state, frankly. So anyway, anybody have any other comments before we're closing this meeting? I think this is record time. We're out of here at 3:00. So thank you all very much. I want to welcome Alex Price here from Project Opioid. I know that Michael Schlossman and I will be participating, and several of you probably are as well on the Zoom meeting. And you'll be invited every time, Alex. So I hope to see you back.
Al, this was great. Thank you so much for your hospitality here. Really appreciate it.
I think a lot of the things that we talked about at the meeting are very, very important to your group and what you do, because we're all silos and we're trying to pull all the silos together, because with one voice we're going to achieve so much more.
Yeah, and we've got some interesting relationships in DC, and so let me see if we can source some folks to be able to shed some light. No one's saying a whole lot candidly, unfortunately, but I'll be working on that as well.
Okay. Thank you, Alex. Okay, everybody have a great rest of the week and a great month, great Memorial Day. And we'll convene in July. We'll let you know the date within the next week or two. Anyway, thank you all very much.
Thank you.
Bye-bye.
Thank you, Al.
Thanks, Al.
Good day.
Take care, everybody.